All right. Well, good morning, everyone. I've got 9 o'clock. It is July 21st, 2025. Thank you guys for being live on the call this morning. And it's another Monday here at Health Plan Markets. We're in lock-in for both Medicare and ACA seasons as normal. You guys should know that. But we're going to talk about things that you can be doing right now, today, and moving forward and getting ready for AEP and OE as real time keeps moving on us. So that's what it is. But as we normally start, we are here to serve those that serve others. That is you. Health Plan Markets exists to ensure that we're delivering the services and support that you need in order to be the best agent that you can be for yourself and for your clients. So that's our mission. That's what we're going to continue to work on and do here, and keep it going. So, all right. So, John, I know you're on the call. Nick, you're on the call too. I'm going to ask you guys to man the chat here this morning. So thank you for keeping that up to date. Good morning, guys. I really appreciate you guys being here. And then if anyone's not on mute, if you can mute, just in case. I think everybody else should be on mute, so that should be good. As I'm starting the call this morning, I do want to ask one thing from everybody that's on here, and those of you that are still joining today. What is one thing that you'd like to see from this call? If it's a topic, if it's a format, if it's a certain guest speaker, is it anything really? Is there certain information that you'd like to see? Anything at all that you'd like to hear on this call, please put it in the chat today so we can see what's going on and I can start adding content. The last thing that I want to do is add all this content and it's not stuff that you guys really need or want or is helpful for you. So that's the whole idea here is really to create something that you want. So this morning, whatever you're looking for from this call, those of you that are live, it's 9 o'clock on a Monday. I appreciate you guys being here. So I want to make sure that you get the best bang for your buck. So Mary's saying changes from Cigna for 2025 and 2026. Appreciate that. So that's really great. I think, Nick, maybe we should have Cigna on one of these calls. We'll see if we can get them on. But if not, I can grab some information on that. So I appreciate that, Mary. So anything at all, if you want, put it in the chat here as we're going through this morning, and we'll make it work. Okay. With that said, I am going to go ahead and jump into the training calendar. So if you do not have HQ, please make sure that you reach out to support@askhpm.com. We want to make sure that you guys have that. So if you can see my screen, if you guys can give me a thumbs up or a yay in the chat, just want to make sure that you guys can see my screen okay. Yes, got a thumbs up. Awesome. Thanks, guys. All right. So where we normally go on the left-hand side, well, first off, this is our homepage on HQ. Want to remind you guys, AHIP 2025 recerts are complete. If you've gotten your recerts complete, put it in the chat. Brag a little bit. Anybody got their AHIP done? Put it in the chat. If you haven't gotten it done, keep in mind, guys, we're already a month in to 2026, believe it or not. And we've got less than 90 days to get ready for AEP. So if you haven't gotten your AHIP done, please do so. Tina's got her AHIP done. Way to go, Tina. Congratulations. And again, I want to also remind you guys that if you are if you've gotten your stuff done, go over to contracting, my documents here, click my documents, and you can upload your AHIP right here. You can upload all of your certifications that you're getting right here on HQ. So you don't have to email, you don't have to do any of that. If you're using our AHIP link, then you don't even need to upload your AHIP. We can actually download that. And if that's wrong, John, please correct me, but I'm pretty sure that we can pull down your cert, so you don't even need to send that to us. So appreciate that. Rosie's done. Way to go. Natalie's done, except for Cigna and Centene. Gail's done. Way to go. AHIP done for Jake and Mary Ronnie and Lamont. Way to go, guys. Appreciate that. Okay. Let's check out the training calendar for today. We're going to click learning, go down to training calendar, and bada bing, here we are. We're in the third week. No, we're in the fourth week of July already. Can you believe that? It's crazy. So we're going to go to the week here. We've got a couple of trainings for Elevance today at 10 o'clock. They're doing an English session for the SEPs and Medicare. So if you're wanting to sell right now and continue that ball rolling, you need to understand special election periods. That's the name of the game, special election periods. So they have an English version at 10 and then in Espanol at 11 o'clock. Our contracting team is available at 10:30 this morning. If you have any questions about recertifications or contracting or onboarding or any of that, they're going to be available from 10:30 to 11:30 today. United Healthcare is also doing their 2026 certification readiness today at 1 o'clock. Tomorrow, Devoted doing overcoming objections at 11 o'clock. And then if you're in the Tampa market, Optum's doing an agent mixer at 4 o'clock. So check that out. The link's in the training calendar. You can register there. Our very own Al Clancy is available on Wednesday at 9:30. He's your coach. He's your guru. Anything that you need to move the needle in your business. We've got Spark hosting an effective telephonic consultation. So if you're a little woozy on how to do this business over the phone, this might be a great option for you. That's at noon on Wednesday. And then you've got AvMed. They're doing a group presentation. Now, we had Josh on last week, and they're moving more into the group section. He's moving over to the group section. They have announced they're no longer going to be offering Medicare Advantage plans as of 2026. So if you do have any AvMed business on Medicare today, we're going to reach out to you and let you know, hey, this coming AEP, you're going to have to make a move away from that plan. So you're going to have to rewrite those folks for 1/1. I don't think we have a ton of that business, but just want to make sure that you guys are aware of that, that they're going to have to make a move. But they are going to be doing a group presentation. We got a lot of interested folks on how to do group health insurance. That's on Wednesday at 2 o'clock. So check that out, 2 o'clock on Wednesday. The link is in HQ under learning and the training calendar here. So that's on the 23rd. Moving over to the 24th, which is July 24th, Thursday, United Healthcare conducting a successful event. This is one of the things you guys need to be doing to generate leads. So if you don't have enough leads in your pipeline, events. How to do that, 11 o'clock on Thursday. Devoted, again, another SEP training through Rest of Year, or ROY, what we call, and we were talking about that today. That's at 12:30 on Thursday. And then we've got HQ training on this platform that you're seeing here on your screen. That's at 3 o'clock on Thursday. Fridays, we've got Tom available for HPM shop and any selling tools that you might need, 9:30 on Friday. And then United Healthcare, TRICARE for Life, and VA opportunities, 11 o'clock on Friday. So those are your trainings for the week. Remember, guys, we got to keep one foot in the classroom and the other one in the field at all times. Whether you've been in this business 10 minutes or 10 years, doesn't matter. We're always learning. This is a learning business. Everything's changed and everything's going to change again. So it's your opportunity. It's your job to stay on to this stuff and ensure that you know what you're talking about so you can educate people and get them down the pipe. All right. Went through the training calendar, our AHIP link. Just as a reminder, I really appreciate everybody using the AHIP link this year. We've had more people using our AHIP link this year than ever before, so we do appreciate that. And then Dave posted NABIP. Yes, we've got our, thank you, Dave, for posting that. We've got our Florida Summit coming up, Central Florida Summit coming up. And he put the link there to register. Again, guys, we are an advocate of NABIP, and we would love to see you there. So click there, register. I'm actually on the speaker panel, so if you want to see me live and in person, I'll be there. I'll be talking. I'll be wandering around. I'll be shaking hands and kissing babies, not kissing hands and shaking babies. We don't want to do that. So thanks, Dave, for the reminder. Appreciate that. I also put in the chat our AHIP link there. And then last week, Anne Marie was talking about NABIP has their link in case you want to use that as well. It's a little bit cheaper than AHIP, and everyone takes it except for Florida Blue and Aetna at this point. And they have their own trainings, I think. So you can use that as well. Okay, gonna move on to, we do have a special guest this morning, but I'm gonna check to see if he is in the crowd here. Looking. Okay, yeah, he's there.
Sean's on.
Yeah, got him. All right. I'm going to pass the mic over to Sean from Dedicated in just a minute. But before I do that, I want to share a quick sales strategy. I want to share something that's worked for me in the past, and then I'll hand the mic over to Sean here in just a minute. And then either Nick, I don't know if you can do it, or John, you can make him a presenter here in just a minute. I'm going to give you guys more control over this thing. So sales strategy. I have a strategy that I like to call the 10-10-10. 10-10-10. If you got a pen and a piece of paper close by, write this down. Or if you're mobile, or if you have, a notes app on your phone, or if you've got a stone tablet and a rock, whatever you've got, write this down. This has probably been one of the most impactful things to help with production that I've ever found. Okay. I'm gonna stop sharing here in a second. Here we go. Okay, 10-10-10. It's a very simple concept. Okay. Before 10 a.m. every workday, before 10 a.m., you're going to send 10 emails, 10 text messages, and make 10 phone calls. Again, before 10 a.m. So I call it the 10-10-10. Easy to remember. 10-10-10. Now, the emails, phone calls, and text messages should be to different people, and they also must be outgoing, not incoming. You're not responding to your text messages and you count, like your daughter texts you like, hey, I got a new boyfriend. Okay, no, that doesn't count. I'm talking about business outgoing text messages. Hey, haven't talked to you in a while. Let's get together for coffee. That's a text, right? Hey, I have this idea for leads. That's a text message. You can even use us, right? So 10 phone calls, 10 emails, 10 text messages to all different people before 10 a.m. Now, what's this going to do? Every day, if you do this, that's 30 interactions. 30 interactions. Now, half of these people aren't going to respond right away, okay, or at all. But you just sent out 30 messages into the world, okay? Now, let's compound this, all right? 30 interactions you initiated times 5. Times 5. That's 150 interactions in a week. 150 interactions that you're trying to go out there and create, okay? Let's time that by 4, because you got 4 weeks. Let's just say, besides July, we've got like 5 weeks here. 4 weeks, that's 600 interactions in a month. 600 interactions. Now, if you're doing it right, like don't be texting like, your college best friend and stuff. I'm not talking about that. I'm talking about business stuff, right? Are you talking to your providers? Are you talking to the health plans? Are you talking to maybe an agent that does PNC, pharmacies? I mean, it doesn't end. Are you looking for event sites? Make 10 phone calls before 10 a.m. Okay. It will challenge you. It's going to get hard, but I guarantee you, you will get very busy very quick. Okay. In fact, you'll probably get so busy that you're not going to be able to do the 10-10-10. But if you're struggling with sales, if you're struggling with lead generation, if you're struggling with pretty much anything just to kind of get those wheels moving, I would say go with this. And if you don't have enough contacts, if you're new to the business, whatever, start doing research, right? Ask your FMO. Here we are. Who can I call, Justin? Make me a list of people I can call. Where should I go? What should I say? Start generating this stuff. Those of you that have hit a plateau, this is a great way to set yourself on fire, okay? Now let's say out of those 600, let's just say 5% gives you a return on sales, 5%, okay, 600. That's 30 sales a month. 30 sales a month. Anybody here want 30 sales a month? Put it in the chat. Give me a clap. Give me a thumbs up. Give me some, like, who wants 30 sales a month? Now, I'm not guaranteeing that, but like, I'm just saying, like, that's only 5%, right? So 10, 10, 10. How is it going to work for you? 10, 10, 10. 10 phone calls, 10 emails, 10 text messages before 10 a.m. I want to see a challenge in that. Who's up for the challenge? Put it in the chat. Who's going to try it out? And then I would love to hear next week when we get together, anybody that's been doing the 10, 10, 10, I'd love to hear more about it and see how it's been working for you. So with that, I've got Sean here from our friends at Dedicated. I'm going to make him a presenter. So Sean's going to connect here. It might take a second. Sean, just go ahead and check your mic. I know you're not new to this, but sometimes these things can be funky. So Sean's going to introduce himself from Dedicated, and he's going to give you the good and the wonderful. There he is, looking sharp as always. We've got you, man. How you been?
Doing fantastic. Thanks, Justin, for the warm introduction. Always a pleasure to join HPM. You guys are a wonderful partner for us. Appreciate the support that you guys give yourself, Sergio, Nick, Victor, Al, Arlene. Arlene and I actually go way back to my captive days in insurance. So awesome. Thankful for the invite and having me on to share some of the wonderful things going on here at Dedicated.
Yeah, we appreciate you and thank you for your partnership. You've been taking really good care of the agents that have been working with you. And by the way, it's no coincidence that most of our top producers work with ChenMed. It's not a coincidence, guys. So pay attention this morning. All yours, Sean.
Awesome. Can you guys see my screen?
Beautiful.
Awesome. All right. No, like Justin mentioned, we love working with you guys. A lot of the big or heavy hitters as far as partnership with Dedicated do come from the HPM family. And I think that goes back to definitely the support system that you guys have going on there. I've had the luxury of being able to meet with Justin, Nick, Sergio on the back end as far as doing some strategic thinking, seeing some of the tools that you guys utilize to be successful. So I know that they're setting you guys up for success, and it really spills over into the provider world. So appreciate the opportunity, like I said, once again. I'm going to start the presentation with a little bit of an ask. So I really want you guys to just kind of imagine a world where when you turn 65, the government just all of a sudden says, we're going to give you a brand new car. This is going to be the last car you have. We're going to ask that you take care of it, use it however you want, but we're going to give you the car. We're going to put gas in it for you, do maintenance, or cover your maintenance, and it's free and clear. You don't have to pay for it. You can imagine what that would look like, right? You'd probably travel from coast to coast, let your kids borrow it, kind of run it into the ground. They're probably going to vacations and things of that nature. But if you have two types of maintenance options that you can choose from, one of it being once a year where you get your oil changed and possibly kick the tires, and then the other being a more frequent checkups where maybe you're taking it in almost on a monthly basis. The mechanic really gets to know you. They're looking under the hood every time you go in and really diagnosing and trying to prevent problems from happening. Think about that in your head as far as which one would allow you to keep that car maintained longer, running longer, and probably last you your lifetime if you could have a car in that scenario. That's kind of the difference in that Dedicated brings and where healthcare we believe is going. That's value-based care, right? It's a system in which we take in patients, but we don't just take them in to see them once a year or to give them med refills. We're taking them in with a vested interest as far as maintaining longevity of life and making sure that we're not looking at to be retroactive as far as, hey, I'm sick, now treat me. We're being proactive in making sure that we're trying to prevent as much as we can from happening to them. So who we are. We're transforming healthcare with a unique approach to primary care. We honor Medicare eligible seniors by providing affordable VIP care that detects and prevents high-risk diseases and simplifies complex care. What you see with Dedicated is we tend to go into neighborhoods and locations where people don't tend to have the most quality of healthcare systems. They're not used to quality healthcare. We really target underserved populations. We have 3 brands that we go by: Dedicated, which is what's here in Orlando. Also, if you're listening to me from the Tampa market, you'll notice Dedicated in Tampa. GenCare, if you're a little further north, Georgia, Virginia markets, we're labeled as GenCare. And then Chen Senior, which is really where we got our foundation. That's in South Florida. We have 20 centers with the name of Chen Senior Medical Centers. Here's a breakdown of where we are. We have a high concentration here in Florida, but we branch out to 12 different states. 20 of our centers are in Broward, Miami-Dade. We have 34 GenCare centers throughout Atlanta, Chicago, Louisville, New Orleans, Richmond, Virginia, and Tidewater, Virginia. Then 57 centers, and really where we see ourselves going more as far as branding is located throughout the rest of the United States, some being here in Florida, Ohio, Michigan, Texas, Tennessee, Pennsylvania, and Missouri as well. So if you are doing any type of business in any of these states, I encourage you to partner with us and make sure that we know when your patients are being placed on our panels, because that's the foundation of how we can help protect your book of business. Our approach is different because we are full risk value-based care, but it's an approach that consistently delivers better outcomes. What we found is that we see fewer emergency room visits to the tune of 35% over fee-based care clinics, 51% fewer hospitalizations, and 80% fewer patients than the typical primary care provider normally sees. Our providers tend to have a panel of somewhere in the range of 400 to 450 patients, whereas your typical provider may have anywhere upwards of 2,000 to 3,000 patients on their panels. This allows us to be able to spend more time with patients on a more frequent basis to really get to know them and ensure that we're being proactive in regards to their care. How we're different. We prioritize whole personal care. We invest in our patients on day one, running a complete health assessment to develop a comprehensive personalized care plan. We make care convenient. We offer 24/7 access to care and conduct laboratory services and screenings and dispense more than 400 plus medications conveniently on site. On top of that 24/7 care, we actually are open on Saturdays as well, physical location. Here in Orlando, our Fairview Shores office, which is off of Lee Road, is the location that we open on Saturdays, and we bring in patients from all over. Doesn't matter the distance or the cost for transportation. We provide transportation for them to come in to see us on the weekend. We focus on primary prevention. We see patients as often as necessary to optimize their health, typically once per month, but it can vary depending on patient's situation and health. We offer same-day appointments, walk-in, and virtual care visits. We simplify complex care. We collaborate with a vast network of trusted specialists and hospitals to coordinate complex and specialty care when needed. And like I mentioned before, 450 maximum patients on the are for our doctors' panels. And this is at no additional cost to patients. The total health visit is a series of tests and screenings designed to give us a complete view of a patient's health. These are the series of tests that we run when a patient first joins us so that we can get a good picture of what their health situation is. It's administered before the patient's first official visit to the provider, conducted on site by our care teams. This allows our providers to use the first visit to get to really know the patient, dig into their health history, see what the results were in regards to the tests that were ran. And those tests that were ran, they consist of 9 simple questions about sleep patterns, diet, and the patient's overall feelings on their health screenings, echo, EKG, labs, A1C, COPD, PHQ-9, and BBS or skin health. And we also attempt to get medical records to review prior to the patient first visit with their doctor. Some of the services that we offer on site are you have your primary care provider, your PCP, cardiology. Some of our centers offer acupuncture, nursing, podiatry, social workers. Here in the market, we have 2 social workers that rotate between centers. Medication services are available, labs and testing, x-rays on site. There is one clinic that's on site that does not have an x-ray at this time, but we make sure that those patients get to a site that does have x-rays available to them. Transportation coordination for appointments, exercise, educational, and social events as well. I think this is probably what's one of those things that is very important for you guys to know, how to work with this, right? What do we offer for your business? We have a team of marketers in the market that we call membership growth consultants, or MGCs. What they do is they guide your patients internally. They help set up appointments and offer quality customer service to your clients. They're also in constant contact with you as referring agents. They offer loyalty and respect to your clients and to you. We never initiate any changes to an existing Medicare Advantage plan. And we also refer benefit questions back to the agent on record. But the key part there is agent on record and making sure that you are listed as the agent who's referred that business to us. The way that we keep track of agent on record is tracking through Salesforce. Our staff is trained on agent of record and the importance of it. If you hand off a patient to one of our MGCs, it's their responsibility to then go ahead and make sure that you're listed as agent on record, because when that patient comes back to us and says, hey, I've got an issue in regards to my insurance, or maybe I'm looking for additional benefits, they're going to then look in our Salesforce CRM to ensure that that patient gets back to you. And it's not only our MGCs that are trained on that, but also our operational staff members as well. So what we're looking to do is really build a strong partnership and grow together. Things that we can do together are really connections to community contacts to engage in neighborhoods that we serve. That includes community events. I think, like Justin mentioned earlier, the most powerful relationships and ones that have, or I would say, bear the most fruit with us are those where we're working hand in hand. You have the agent coming to us and asking, hey, what events are you doing? We're doing the same thing to serve the community. We do a number of food drives, food pantries. We go to communities with your agents to really give back, and we'll partner with you guys and sponsor a lot of those things, as long as we see an added benefit. So we want to make sure that everything that we're doing together is really in the best benefit of seniors, as well as growing both your business as well as ours. We'll co-host educational events on site at our centers and in our local communities, such as Medicare 101s, low-income subsidy events, T65 seminars. We've done a number of those over the summer where we've actually sponsored them for you. And you come in, do your presentations, but you're sitting in front of a number of potential either T65 members or Medicare eligible members who are just looking for general advice. And on average, those seminars have attendance of 20 to 30 people. Access to marketing resources to promote your services, and co-branding and marketing sponsorship opportunities. We've got unmatched patient satisfaction. 96% of our patients were able to get an appointment to see their physician right away. 92% of those patients were satisfied with the amount of time that they spent with their physicians. 96% of our patients feel as though our staff treated them with courtesy and respect, and 95% of our patients say their doctor listens carefully to them. Another stat that's not listed here is that during last AEP, we had over 87% retention rate, which means, and I think is the added benefit for you all, is that your patients aren't going anywhere. When they're with Dedicated, they're sticking with us, which means that we're retaining them for our clinics, but we're also retaining them for you. If they do have questions in regards to their insurance during AEP, we're referring them back to you, so you guys are the ones that are able to answer those questions and make sure that they're in the right place for the preceding year. So with that, I am going to turn over for any questions that you guys might have in regards to the presentation.
Well, first of all, Sean, we might have lost him. Oh no, there he is. Like, what happened? First of all, thank you for your presentation. It's one of the better ones that we've had on in a while. I love the slideshow and the info that you guys have. I mean, it's very clean, easy to read, and easy to digest. If you guys do have a question, put it in the chat here, and we're glad to address it. James had mentioned, he was asking where the locations were. I posted the link to your, find a location from Dedicated, but if there's a different link for ChenMed, if you don't mind posting that in there, but I'm pretty sure they can get to wherever they need to from Dedicated. Could be wrong, but like that's the one I've been using anyway.
That link posted, Justin, actually gets you to all of our sites, all 121 sites.
Awesome. So I think one of the things that that I want to make sure that everyone understands about working with physicians is it's not about what they're going to do for you. This relationship is not hinged on, oh, they don't give me any leads, I gave them a patient, they never did anything for me. Like, that's just not a thing, guys. Okay, so I really want everyone, I want to challenge your mindset to know, like, this is a partner where you work hard to get your clients, okay? You enroll them, and the last thing that you want to do is throw your clients to the wolves. And that happens at physician offices. You put them in a clinic because, oh, this one's 5 minutes away. If you don't have a relationship with that physician group, and there's another agent that does, you are putting your business at risk. So the main objective on why you should be working with a physician that you trust, that you know, that you've built a relationship with, is they are going to help you protect your business. That's objective number one. Now, objective number two is obviously like building that relationship so you feel good about working together in the community. It's not about lead gen. I mean, Sean didn't come on this call and say, oh, I'm going to promise you leads. He did not say that. I want to be clear about that because there's translations on here, right? But what he did say, he's got tons of opportunities to get you in front of seniors to help you grow your book of business. That is true. And I have witnessed it from day one. They talk the talk and they walk the walk. And like I said at the top on the intro for Sean is the fact that, it's no coincidence that our top producers are working very closely with Dedicated. So put the 2 and 2 together on that, guys. That's true. Sean, they're asking for your contact information. So if you got an email or a bat phone that they can reach you at, if you can post that in the chat, that'd be cool. And then while you're doing that, I'm going to ask you the main question here for me. So both Sean and I are what I like to call recovering insurance agents. He has been in your seat, guys. He knows what it's like to go out every day and pound the pavement looking for leads. He knows sales. He's been an insurance agent. He's sold Medicare Advantage. So he knows what you guys go through on a daily basis. So this is, first of all, that's important for your, just so you know who you're working with, okay? He's not like, oh yeah, I don't know anything about your business, because there's a lot of physicians and folks that they don't know what you guys do, right? So knowing that, Sean, and where we are today and the landscape, if you went back to sales, what are some of the things that you'd be doing right now? You know, it's July 21st. You know, there's disruption in the market as usual. You see what's going on. AEP is around the corner. What would you recommend these guys be doing right now? Any thoughts on that? Because I love your perspective, and I love the way that you think, and because you've sat on both sides of the fence like I have. So just want to pass the mic and see your thoughts on that.
Absolutely. That's a great question, Justin. So as Justin mentioned, I definitely come from your world. I was an insurance agent, was a broker for a little bit, but then I became a captive for a number of years. And being a captive insurance agent is tough, right? Because you're selling one product, and you're really depending on that relationship and your book of business to carry you through in order to meet your goals. I'm going to tell you guys just a brief story. So Dedicated's only been in the Orlando market for about 5 years. And it was around that time that I began my relationship with Dedicated. And the reason that I really gained traction with Dedicated and went all in with what we were doing here was because I saw the difference between when I was placing patients at other primary care offices and when I placed patients at Dedicated offices. One, it was less of a headache for me because I didn't receive complaints. My patients weren't complaining, oh, I had to wait an hour in order for me to be seen on my first visit. They couldn't get me in for 3 to 6 months in order for me to be seen, things of that nature. All things that should resonate with you, because those type of interactions, especially when you first sign someone up for an insurance plan, can be detrimental, right? Those are the same people that are probably going to be jumping off your books in 2 months, because if you can't get them, if you can't give them the right information as far as what doctor to go to, how can they trust that you've got their best interest as far as their health plans as well, right? So it did wonders for me as far as the relationship with my patients, the retention, and with that, I began to place a couple hundred patients with Dedicated within a year's time frame, and I was all the better for it when it came to that standpoint. Back to your question, Justin, if I'm you and I'm sitting in your seat, especially for those of you who are new to the Medicare space, I'm out there and I'm on top of doing everything you've got to do as far as certifications and AHIP. But you're looking for events. You're out there looking for opportunities. Now's the best time to start, because AEP is right around the corner. And guess what? A lot of the people who aren't on this call are not ready to begin their AEP planning because they're out on vacation. You've got a jump start on, right? So it's imperative that you find your locations, you find your partnerships, people that you really want to do business with now, so that way you're setting yourself up for success for your AEP season.
That's awesome advice, and I'll say also, Sean wasn't just an agent. I mean, he was a top producer, guys. I mean, this is somebody that knows how to bring in the bacon, right? So he's right. I mean, look, guys, we're less than 90 days away from AEP. If you're focused on Medicare, the biggest thing that you got to know is where your leads going to come from. where are your leads going to come from? And if you don't have leads now, if you don't have anything in the pipeline, you've got to build that now, because if you start on October 15th, it's too late. Come back later. Come back next year. You know? So do you have enough activity? Do you have enough leads in your pipeline? And that's exactly what Sean's saying. So if anything, if you take
point, Justin, I just want to give one other piece of advice, that this job, or your job as an insurance agent, a lot of times you can have a great week or a great day or so and think, okay, I'm doing well. But the job is really about consistency. So for those of you who are on this call and you're doing this in the middle of July and really preparing, kudos to all of you, because if you're consistent, the job gets a lot easier in regards to being able to find locations, gather leads, and things of that nature. But you have to be out there doing it on a day in, day out basis. The way I used to think about it is, every day I woke up, I was unemployed and I had to go out there and earn a paycheck. If you think about it that way, you will be successful.
Yeah, I love that. And Sergio was a mentor of mine when I first started selling, and I always remember the first thing that he taught me. He goes, every day I got to do 2 sales. That was his goal. Every day I got to do 2 sales. 2 sales was in the top of his head every day. 2 sales, one for me, one for my family. That was like a thing for him. But the consistency is absolute. I mean, that's kind of why I really got into like Medis, because I would have rather done 15 sales every month than like nothing, and then in AEP stress myself out to get as many sales as I can to make what I needed to make. So AEP for me just became gravy. It was like, okay, well, whatever, those opportunities still came. And then also, if you disappear and then all of a sudden something happens, like, a health plan decides they're going to back out, or a doctor's office isn't going to take a certain plan, who's going to get that business? The guy that shows up every month or every other week and is there even in July, August, September, or the guy that shows up in October once, right? Or November when the thing happens, right? They're going to go with the person that's always been there, the one that they trust, the one that they know, the one that they have the relationship with. And I've been able, in my past life, get huge windfalls at physicians' offices, sometimes in the hundreds of patients that needed to be converted, because I was the only one that showed up every time. Every time I was the only one. People disappear, people come and go. But consistency, that's a huge piece of that pie. So thanks for mentioning that, John. Rock and roll. All right, I know we're over time. Sean, thanks for your extra time on this. You got brownie points from us. We appreciate it. Great presentation.
I tried to post my information in the chat. It says sending on my end. I'm not sure if you guys see it.
We got it. Yeah, we got it. Yeah,
Perfect.
It's in the chat. So, and in case if you don't see it in the chat, or if you need our information, we can always connect you with Sean. No problem at all. Our email again is support@askhpm.com. You guys know that. But Sean's info is in the chat. You can snap that up, and then he's very responsive. I mean, what you see is what you get. He's easygoing. He understands the business, and he's a pleasure to work with. So, Sean, thanks again for being here. We really appreciate you, man.
Thank you, guys. Have a good one.
You too. All right, everyone. That's it for this week. We really appreciate you guys being here. We'll do this again on Monday, same time, same station. And until then, I hope you have a fantastic and wonderful and productive week. Try that 10-10-10 thing. I'd love to hear more about it next week. We'll ask about it. So thanks again, guys. Have a great week. Take care.